Good afternoon, Dr. Sarvar and here from Personalized Physical Therapy and Wellness with Dr. Jane Bowser. We're back again with part 2 of our tennis elbow series, and we're talking about the treatment for tennis elbow. And so if you missed the part 1 for the causes of tennis elbow and why it happens, please go back. We do recommend you to refer back to the other video that we did right before, like a couple weeks ago. And so this is for the treatment piece. And so we want to talk about 3 specific tips that you can do to address the tennis elbow. And the first thing you want to do, you find wherever the tender spot is on your wrist, on the side of your elbow. So in her case, be right there. And you put a little bit of lotion, take a butter knife, and you just go back of the butter knife lengthwise. So 2 different strokes. One is lengthwise, just nice and gentle. You want to feel a little bit of tenderness, the same tenderness that you would feel on the palpation, but not a whole lot of pressure. Very gentle. And then the other move is the across. Yep, just like that. So one is lengthwise and the other one is across the muscle fibers. Usually the muscle fibers on the tennis elbow muscle, which is the extensor radialis carpi brevis, and so it goes lengthwise this way, and you want to address both of them, straight and then across. So that's the first tip, is the massage.
And not too hard, not too hard.
Yeah.
Because I have a tendency to do everything too hard, so not too hard.
Correct, absolutely. And so you could have a butter knife and do the massage. You move into the isometrics piece because you want to release all the adhesions first, and then you want to strengthen all the muscle fibers in the area. So you have major 4 muscle groups: the extensors, the flexors, the radial deviators, and the ulnar deviators. So 4 of them. So this is a rubber band that Jane has, and she is wearing.
Amazon.
Very good, yeah. And there are different brands and different intensity, the rubber band intensity. So this is perfect for her. And so you're wearing it and opening like Jane is doing just now. And you hold it for maybe a couple seconds and you release, and you do that about 10 repetitions, maybe once or twice a day is a good frequency. The other muscle that you want to also target is the ECRB, which is the extensor carpi radialis brevis, which is also one of the culprit muscles in the tennis elbow. And so you're wearing it much deeper into the fingers, maybe on the second knuckle area. And then you're opening, excellent, opening the fingers apart more than just extension. And you hold that for a couple of seconds and do 5 of them. And one thing that I would like to point, Jane, is that you had the elbow bent, and you can do it either way. You can do it bent or straight, because that's how you usually trigger. So as you progress from the bent to the straight position. So that's a good feedback there. And then the flexor group. So that's the front flexor area. And so again, a stress ball or a stress ring, just a nice exerciser, grip exerciser.
Yeah, this really helps get rid of stress too.
Oh, big time.
So,
big time.
very needed these days.
True, especially these days. Now comes the dumbbell. So basically we did the flexor, the extensor. We're going to target the radial deviators, and Jane is very nicely demonstrating the actual radial deviation motion that we tend to do in tennis, or even during day-to-day activities like driving or computer use. And then the other group, which is the ulnar deviators, is the back ulnar deviation motion that she's doing. And so this is the second half of the treatment, or second part of the treatment, which is the strengthening and the isometrics. We don't want to have any pain with any of these movements, and if you do, please let us know. We can certainly help you. And then the third last part is the ice pack. And you want to have a nice ice cube in itself, and you can apply the ice cube directly, freeze water in a styrofoam cup, and put the ice cube directly and kind of massage it once or twice. You can also use an ice pack like how Jane has, and you're placing it and sort of sliding and rubbing on that area and doing that for about a minute, minute and a half, 2 minutes. You can even strap it and just leave it alone for about 10 minutes. And that's a good practice for keeping all of the little inflammatory response that we gave for increased healing to subside and kind of calm down and allow for more healing happening over time.
So best to do this after you do the exercises as well as after you play?
So yeah, I would recommend, absolutely, yeah. After play is important because that's when you're going to re-trigger if that's the cause. And so it's good practice to have an ice pack or even just some ice cubes around and just kind of placing it in that area. Absolutely. Okay.
Awesome.
Well, very good. Thank you, Jane, again for participating with our treatment. And thanks everyone who's watching. and we'll be back again with the COVID-19 Health Series.